Future Hospital Commission sets out a vision for a new way of delivering care. The emergency floor at Worthing is a new development in which we've brought together acute medicine, acute frailty unit and acute surgical admissions into one footprint so that we can provide joined up care for patients from the point at which they arrive all the way to the point where they go home. It's not a new concept, but it's an evolution of an idea that patients don't always present with a clear set of needs. And sometimes somebody's referred to medicine who actually needs some input from the surgeons or vice versa. Somebody might present who is frail, elderly, who needs input from a multidisciplinary team, and what we aim to do is provide that here. The multidisciplinary team is there to address those needs on an individualised basis, and it really speeds up the process from the point of arrival all the way through to discharge. We've got access to physiotherapy, occupational therapy and social work teams. We've got a pharmacy team who are there to ensure that patients' medications are correctly prescribed, that if they need to go home on new medications, we can quickly get access to those medications and get them home with them. So each part of the team is working together to improve the journey for the patient all the way through the process. We've divided the area into 4 zones. Zone A is ambulatory care. Ambulatory care is an important part of acute medicine. It's a way for us to rapidly assess, provide a treatment plan and a discharge plan for patients who would have previously been admitted to hospital. Within ambulatory care, we've got different components. We've got an area in which we've got trolleys and chairs and we can see patients. We've got a waiting area and we've got a procedure room and a consulting room. And that allows us the flexibility to take people to whichever area they're most appropriately seen in and to move them around so we can get people seen quickly. We run the area with a nurse and a doctor working very closely together, and we've had great success already with surgical patients really coming in, being assessed rapidly and either going to theatre or going home if appropriate. So we've seen some really good positive early benefits already. Zones B and C are areas in which patients, either medical or surgical or elderly care patients, will spend up to 72 hours, and during that time they'll have intensive therapy, medical treatment and a plan already in place for their discharge. And then that moves us through to Zone D, which is the Department of Medicine for the Elderly, or the Acute Frailty Unit. So we're quite unique in that we have an independent acute frailty unit within the emergency floor, and that allows us to focus our attention, particularly with regards to the multidisciplinary team, on the needs of the acute frail patients.
So one of the great benefits of the emergency floor is we've co-located the acute frailty unit onto the emergency floor. So we've brought the geriatricians next door to the physicians and the surgeons, which means that we are all working as one big team, but the patients that need it get a comprehensive geriatric assessment at the point of entering the hospital. And so we lead a daily multidisciplinary team meeting where we look at not just the medical, but the psychological, the social implications of a patient's admission, and we decide where we can manage them appropriately and come up with a treatment regime for them. And then in bed 20, a 91-year-old gentleman who lives in a 4-bedroom bungalow with his wife. He's independently mobile. He's been walking about a mile in the last year, and he sometimes uses a stick outside. He came in with a fall. Plan is to try and get him up and about. He does have a postural drop, so we might need to keep an eye on that. Physio-wise, what's he like?
Yeah, he did well. He got out of bed independently, walked 60 metres with the frame. Okay. Quite steady.
Yeah.
Perhaps home tomorrow with rates.
Okay.
The MDT meetings have been a great change in that having a twice daily meeting with the whole MDT can come together to discuss patients. We can quite quickly work out his needs medically and more holistically so that we can then action those and hopefully get the patient home quicker and safer with the whole team working together.
It's built around each patient's needs. It's about reducing the number of moves for patients. It's about getting people home safely, with everyone working together to deliver the highest possible care for our patients. And that's what we're doing here in Worthing.